What if I told you that cancer isn't just one disease? It's over 100 different ones. Each type has its own cause, its own warning signs, and its own treatment path. Yet, most people only think of cancer as a single scary word until it shows up in a test result. Today, we're going to change that. In just 10 minutes, you'll learn the most common types of cancer, how they actually start, what the early clues look like, and the simple screening checks that will truly save your life. By the end of this video, you will know exactly which body changes deserve your attention and what simple steps truly make a difference in prevention. Before we dive in, if you believe prevention starts with knowledge, please hit like and subscribe so you never miss fast, life-saving explainers like this. So, what is cancer? Cancer happens when cells stop following the rules. Instead of dying when they're supposed to, they keep dividing and multiplying, eventually forming lumps or invading nearby tissue. According to the National Cancer Institute, this runaway growth is triggered by genetic changes caused by aging, lifestyle, or environment. Some cancers form solid tumors, like breast or colon cancer. Others start in the blood, like leukemia. The most important thing to remember is this: spotting them early is the key. Most are highly treatable, if caught soon. Skin cancer, the most common. If you live in a sunny climate, this is the one most likely to find you first. The main culprit here is UV radiation from years of sun exposure, or just as risky, tanning beds. The American Cancer Society, ACS, estimates that 1 in 5 Americans will unfortunately get skin cancer by age 70. So what should you watch for? You want to pay attention to any new mole that grows fast, spots that bleed or refuse to heal, and any mole with uneven edges or colors. The checkup is simple. Make sure you get an annual skin exam from your doctor and wear sunscreen with SPF 30 or higher every single day. Breast cancer, second giant killer. The CDC confirms it's the second most common cancer in women, right after skin cancer. Key early signs to monitor are any new lump in the breast or armpit, any unusual nipple discharge, or any dimpling in the breast skin. Your primary checks are performing a monthly self-exam and getting a mammogram every 1 to 2 years after age 40, or earlier if you have a family history. Prostate cancer, the silent one. Prostate cancer often grows very slowly and shows few obvious clues until it's quite advanced. The National Cancer Institute notes that about 1 in 8 men will be diagnosed in their lifetime. Be aware of these symptoms: a weak urine stream, frequent night urination, or nagging pelvic ache. The crucial checkups are the PSA blood test and the digital rectal exam after age 50, or earlier if you are African American or have a strong family history. Early detection here is phenomenal. It leads to a 99% survival rate at 5 years. Lung cancer, the leading killer. This is caused by more than just smoking, air pollution, and past secondhand exposure count, too. The CDC says lung cancer causes a staggering 1 in 5 cancer deaths. Look out for these signs: a chronic, persistent cough, unexplained chest pain, hoarseness that won't go away, or most alarmingly, coughing up blood. The check is targeted. Adults age 50 to 80 with a long smoking history should receive an annual low-dose CT scan. Remember, quitting smoking at any age cuts your risk dramatically and fast. Colorectal cancer, the hidden one. This cancer begins innocently as small polyps that quietly grow inside the colon. The USPSTF now recommends that screening begin early, from age 45 up to 75. The warning signs are blood in the stool, unexplained fatigue, or unintentional weight loss. The standard checks are a colonoscopy every 10 years or a stool-based test performed yearly. Here's why screening is so powerful. Removing polyps early means you are preventing cancer, not just detecting it. Pancreatic cancer, the sneaky one. Pancreatic cancer is notoriously hard to spot until it's late because the pancreas is hidden deep inside the body. Research from Johns Hopkins shows that most cases appear after the age of 60. The key clues are yellowing skin or eyes, which is known as jaundice, abdominal pain, sudden and unexplained onset of diabetes, or very dark urine. The check is reserved. Imaging is usually only performed if you have a strong family history or a known genetic risk. A vital lifestyle tip: stop smoking and maintain a healthy weight. Liver cancer, the inflammation link. This cancer often develops after years of existing liver disease, specifically hepatitis B or C, or from heavy alcohol use. The WHO reports that liver cancer deaths are sadly rising worldwide, especially among older men. Watch for these signs: pain in the upper right abdomen, persistent bloating, jaundice, or deep fatigue. The check is preventative. Regular ultrasound and a blood test, called AFP, are recommended for anyone with chronic liver disease. Get vaccinated for hepatitis B and treat hepatitis C early. Stomach cancer, the digestive disruptor. Stomach cancer is often triggered by the H. pylori bacterial infection, smoking, or a diet high in salty foods. Gastroenterology journals note higher rates in older adults, particularly men. Key clues include chronic indigestion, feeling full after eating very little, or unintentional weight loss. The preventative check is an endoscopy if you have chronic reflux, anemia, or a known family history. A simple dietary tip: eat more fresh fruits and fewer processed meats. Bladder cancer, the smoker's secret. Yes, smoking damages the bladder too. Toxins from cigarettes pass through your kidneys and exit in the urine, irritating the bladder lining. The ACS notes that half of all bladder cancers are smoking related. The single earliest clue is blood in the urine, even if it happens just once. The checkup is simple: urine cytology or cystoscopy if symptoms persist. A great lifestyle tip: drink plenty of water to help flush and dilute toxins. Blood cancers, leukemia, lymphoma, myeloma. These cancers are different. They don't form solid tumors. Instead, they crowd out your healthy blood cells, leading to anemia and severely weakened immunity. The Leukemia Society notes that risk rises sharply after age 60. Clues to watch for are frequent infections, unexplained bone pain, night sweats, or bruising very easily. The key check is a simple complete blood count and following up with your doctor on any persistent, unexplained fatigue. Ovarian and uterine cancers, the whisperers. These cancers start deep inside, and their symptoms can be frustratingly vague. The Mayo Clinic highlights persistent bloating, pelvic pressure, and unexplained changes in bleeding patterns as critical early warnings. The necessary checks include a yearly pelvic exam and reporting any persistent bloating or pain to your doctor immediately. Early stages of these cancers are highly curable. Silence definitely doesn't mean safety. Thyroid cancer, the neck nodule. This is usually slow-growing and, thankfully, highly treatable. Research shows it's most common in women between 40 and 60. Clues include a painless lump in your neck, unexplained hoarseness, or trouble swallowing. The check is simple: a neck ultrasound followed by a biopsy if a lump is found. Most cases caught early have a near 100% survival rate. Kidney cancer, the filter fighter. This is often linked to obesity, smoking, and chronic high blood pressure. Cases naturally rise after age 60. Signs include blood in the urine, persistent back or side pain, or fatigue. The checkup involves a CT or ultrasound if symptoms or family risk is present. Lifestyle advice: stay hydrated and proactively manage your blood pressure to protect your kidneys and heart alike. Cancer is not one disease, but many. And the good news is that most are beatable when caught early. The keys for you are simple: Know your body's baseline, commit to regular screenings, and prioritize a healthy lifestyle, which can prevent up to 40% of all cancers. If this video helped you understand cancer better, comment "Knowledge Saves." Stay aware, stay hopeful,